reporting?
The first media-oriented safe sex campaign in Seattle that the Health Department, AIDS Prevention Project, and Northwest AIDS Foundation collaborated on was in 1986, and it was called The Rules of the Road. The idea was to try to draw some parallels between traffic safety and sexual safety. So we made a little pin, a little lapel pin that had a little traffic sign arrow on it that was kind of the motto of the campaign, and we distributed thousands of those to gay bars and bathhouses and businesses. And then monthly we created posters that were posted around the community. Each of them had a traffic sign that was adapted with a heading such as "Sexual safety is a two-way street," you know, an arrow going this way and an arrow going this way, talking about how there were joint responsibilities between partners in coming up with safe sex. That sort of thing, and I think we'll have some examples of those posters to show you. That was in 1986, and we evaluated that. It was a little difficult to evaluate whether that really had an impact on sexual behavior because the HIV test was brand new. What we wanted to do basically was raise consciousness, and alongside it we were promoting the usefulness of HIV testing. It was that was a fairly difficult thing to do at that time because there were no treatments available. If you tested, there wasn't very much that we could offer you other than help you get a full physical exam and some other kinds of tests short of an HIV test, which we didn't have fully rolled out yet. But when the tests became available, after we did some pilot testing on the early versions of the HIV test in Seattle, there was still argument about whether it was useful to be tested or not. And the Seattle Gay Clinic had one point of view, was fairly skeptical about testing because there were concerns about confidentiality and whether being tested and having people maybe know that you were positive could open you up to discrimination. Public Health Department took, and the Centers for Disease Control took another direction, arguing that the more people who knew that they were infected, the more likely that they were to take responsibility for being safer in their sexual practices, and eventually might be able to get medical interventions as they were developed. So that kind of back and forth happened in the community quite a bit in about 1986, 1987. As time went by, the efficacy of testing and the importance of people knowing their antibody status gained more acceptance as I think the community grew more trustful of government agencies that were, like the Public Health Department, that were handling the test. But there was always some skepticism. Probably Seattle had less difficulty getting testing up and running than many other cities because we had a pretty good relationship between public health and the university and the gay community at that point. But there were pockets of resistance. One of the offshoots of the Rules of the Road campaign was a television spot that was also based on the traffic safety metaphor, and it was simply a group of 4 people standing at a crosswalk, and somebody walks out into the crosswalk, a car is coming, and his buddy pulls him back. And it says, "Please be safe," and there was a reference to the Northwest AIDS Foundation and the Public Health Department. And all the local TV stations refused to air that, simply because it had AIDS in the title. We met and talked, and eventually King TV decided that it was safe to air that spot, and others finally followed. And it was a good outcome because Gene Anderson, who was a longtime anchor and news person at King FM, got very interested in the issue, and eventually she joined the board of the Northwest AIDS Foundation, and for many, many years she was the MC at the annual AIDS Walk. So something good grew out of that. Another little pocket of resistance was when we needed to find a place for the AIDS prevention project that was not identified with a government building. We wanted to move it out of the public safety building. For years, the health department and the police department had shared a building down on 3rd Avenue in James, and there was this, perception in some people's minds that public health and police actions happen hand in hand, and in order to get free of that perception of collusion, we looked for a space away from that government building, but in close to the center of the gay community in Capitol Hill. And we were turned down practically everywhere we went by real estate folks and landlords who just didn't want to have anything to do with AIDS. Eventually, the Seattle Times ran an article about our difficulties in finding a place. We did find a place finally. A landlord that I met and took him and introduced him to several of the researchers at the public health department, and he was a pretty smart negotiator, and that early on I think he realized AIDS was going to be around for quite a while, and that he could make some money by renting to an outfit like ours and maybe be a pioneer in his own right. And so eventually he did rent this place to us. It wasn't ideal, but it was the best that we could find, and we were able to establish a project and do HIV testing, as well as adding on many other allied activities to the AIDS prevention project. And that was in 1987. In terms of the environment that we were working in back then, I think that it's safe to say that it was, I won't say easier, but it was more realistic to expect that in Seattle we could get AIDS-related projects up and running faster and with fewer complications than some other metropolitan areas in the country. And the Centers for Disease Control viewed us that way too, because they wanted to get their demonstration projects up and running, and they were running into problems all over the country, and Dallas and Denver and Long Beach and other places where they were trying to set up these projects. And we were able to get a clinic and get people recruited in long-term studies more quickly than the other cities. And I personally think that some of that had to do with just the environment in Seattle prior to the outbreak of AIDS. Now, looking back to the late 70s, a very important moment in Seattle's history was the Initiative 13 campaign, the campaign against Initiative 13, which would have repealed the City of Seattle's open housing, fair housing and employment ordinance. So many people in the gay community and so many allies of the gay community got involved in that effort, including a lot of health workers, including organizations like the ACLU, and the Dorian Group was very active in that effort. I think that the publicity around that effort and the success of the effort was so great that Seattle was viewed as, one of the middle-sized metropolitan areas in the country where not only was it becoming safe or safer to be a gay or lesbian person, but organizations could thrive and organizations could be created that might have been difficult to create in other environments and in other communities. So I think that a lot of that early civil rights-related groundwork that was laid by the people who worked on the campaign against Initiative 13 and all the allies made Seattle a better place to try to do innovative work around AIDS once the epidemic finally struck here. And looking back, I'd say it wasn't easy, but I can certainly think of other municipal areas around the country where it would have been much, much more difficult to get programs and organizations off the ground.
Do you want to talk a little bit about the One Little Prick campaign?
Oh, in terms of you know, as time went by, we tried to get more and more explicit in our HIV prevention campaigns about sexual behavior, about destigmatizing the HIV test. There was always pushback, and that was just sometimes almost a game. Maybe another one of the more interesting campaigns was when finally a finger prick method for drawing just a tiny sample of blood that you could do yourself was developed to do an HIV test as well as a rapid HIV test. The health department created a media campaign called the Little Prick Campaign, meaning just a little finger prick is all it takes to get an HIV test. A little bit of play on words there. And with the help of a grant, billboards were posted around Capitol Hill and other areas with the large gay community, as well as a traveling billboard that when it was pulled around on the back of the truck with variations on this little prick it doesn't hurt campaign. There was some pushback on that, some folks who wanted the billboards taken down, etc., but not for long, because one, because I think the little bit of humor that was built into it. Folks stepped forward fast in support of the program, and there were so many gay people who just said, "Oh, come off it, please. We're over that. This is not a big deal," as well as a lot of allies who said, "We don't mind having this in our community. We know what's what." So I think that's another example of sort of the ongoing push-pull, but another example of the kind of progress that was made sort of year by year in getting people to not get quite so bent out of shape about fairly explicit language around sexual behavior and HIV testing.
Okay, and when did you retire from the Department of Public Health?
I retired from the Department of Public Health in the year 2000.
Okay, and you were still doing AIDS work?
Yeah, I had left AIDS for a while. I was a community clinic liaison between the health department and community health centers for a number of years. But then I came back for 3 years, and I was manager of a series of epidemiology grants that were doing research on, fairly complicated research around HIV epidemiology, and I left at the end of 3 years and retired at age 65.
Can you think of anything else you'd like to share about your experiences with AIDS activism?
I think I've pretty much covered the territory, I believe.
Okay.